We're speaking to Professor Rajen Naidoo, who's an occupational medicine specialist with UKZN, the University of KwaZulu-Natal. He's also an occupational and environmental epidemiologist. Professor Naidoo, you have a new project starting.
Our project is basically focusing on the heat impacts on the health of children, most specifically on the heat impacts of their respiratory health. This is a project that has been funded by the Wellcome Trust. It's a 3-year project and it is a multinational project. We're working with grade 4 school children in Durban, in Harare in Zimbabwe, and Haramaya in Ethiopia. Essentially, we are concerned that everyday heat is likely to have an impact on the growing lungs of these children from a point of view of interventions that are feasible, that are sustainable, that will then eventually end up protecting their health.
Now, what prompted this investigation?
Well, a number of things, particularly in Durban, we've been working for a long period of time, focusing on the impacts of air pollution on the health of children. Both ourselves and researchers all over the world have shown convincingly that air pollution does impact on the lungs of children. What we're now becoming concerned about is whether exposure to heat could have an added effect or even a synergistic effect. In other words, one making the other worse. And we're not clear about that. But what we know for a fact is that our children are exposed to much higher levels of heat on an everyday basis. Our argument is that it is likely that children schooling above certain thresholds of temperature exposure are likely to be at greater risk for these outcomes.
Summers are longer, summers are hotter. Is that right?
Children are exposed to very hot days on a regular basis in some of the hottest parts of our country. And we need to respond to those rather than just waiting for the days when somebody says, today or the next week, we're likely to experience a heat wave. So basically, our focus is to put together some very sophisticated measures of monitoring the exposure. So in the schools and in the homes of these children, we're going to be monitoring their exposure to heat, looking at things like temperature, humidity, wind speed, wind direction, etc., which all influences how a body responds to heat. Simultaneously, we'll be also measuring exposure to air pollution. We've brought in our collaborators who are experts in developing models which will predict temperature in a microenvironment. So in other words, in a particular school, in a specific school, in a specific home, what is the temperature likely to be? So that's the exposure assessment that we're going to be doing. We're then going to be working together with our collaborators in Zimbabwe and Ethiopia, as well as from universities in Sweden and the UK, in monitoring the physiological responses with these children. So we're going to look at monitoring their heart rates. We're going to look at monitoring their activity across a school day, and we're going to record their exposure to heat on an individual basis. We're going to be doing a series of lung function assessments. The first is basically measuring what the large airways are doing. So it's the large airways of the lungs. We're then also going to be measuring airway inflammation. In other words, particularly in asthmatic children, when they're having an acute attack, their airways become inflamed. So we're wanting to have some measure of airway inflammation. It is very likely that the smaller airways of the lungs, these are the areas of the lungs that you can't pick up on the standard lung function, you can't pick up on x-rays. It's almost, it's actually referred to as the silent airways because you don't know what's going on in those areas. And we're going to be doing a special test called oscillometry. And these tests then tell us what's going on in those very tiny areas of the lungs. And we're going to then relate those changes to the exposure assessments that we're doing, the heat and the pollution measures.
Would you be comparing those measurements to days where it's less hot, or simply to other regions of the country where the temperatures are lower in general?
We do this in a number of ways. One, we're selecting children in three different cities. And one would expect that there will be some levels of variation in the heat exposure. We expect Haramaya in Ethiopia, for example, to be very hot, probably less so in Zimbabwe, and then once again, reasonably hot in Durban. We're also going to be doing measurements in the hot months across these three sites, as well as in the cold months. But more importantly, because we're recording in the same children, we would know that if the changes vary, then the changes are likely to be to those conditions that are changing, and not because, for example, socioeconomic factors or the diet that the child is taking, because we're measuring it in the same child. We realize that we want to understand what the children are feeling, what the children are exposed to. So while we're doing the technical stuff as the sort of researchers, we're also wanting to see how the children express themselves. We're going to give them a little exercise where they're going to play with Play-Doh. And using Play-Doh, they express themselves about the heat conditions in school, in the homes, in social settings. They design little stuff with Play-Doh. The next is we're going to provide a small group of these kids with cameras, and we're asking them to take photographs of things that they believe captures their feelings about heat. And then we will sit down and ask them to explain some of these pictures that they've taken, why they believe that these are expressing their feelings. We're going to be putting on armbands onto them. We're going to be putting all sorts of gadgets. We want to stimulate that inquisitiveness in these children, because by engaging with them, by explaining to them exactly what we're doing, we're also increasing their awareness. And if we recognize that these youngsters are going to be the leaders of tomorrow, then at least we're starting off at the right age.
That's great. If one was to sit in on a Play-Doh session, what would you see, for example?
Well, I've actually had the opportunity to do this. We decided to just do a trial run to see how this will work in the classroom and try to understand if there's any problems. So we did a little pilot with our fourth graders, and I was really amazed at their creativeness. So I mean, we had little children who designed swimming pools, and with using blue Play-Doh for water, or they built pools and built ponds where they created animals drinking water, and sun structures, shade, hats.
Why the choice to work with children, and why the particular population that you chose?
Both adults and children are affected by heat in different ways. However, because we have historically been working with children, we know that their lungs, for example, and other organs are still growing. By the time they reach adulthood, would have already got fixed compromise in their lungs. And we need to know that sooner than later. And that's part of the reason why we've embarked on this project.
The results aren't known yet, but I think in your mind, you also have already interventions in mind. What would those potentially be?
Monitoring the health of the children, monitoring their exposure. A key aspect is engagement with the stakeholders, engagement with the community, engagement with policymakers. We need to address the environment in which these children are located. Obviously, that's the school environment and homes. So maybe it's issues related to structural changes. How is the school day structured? What works best for the children? But clearly, if we talk about altering the school day, then it also has social impacts, because mums and dads and caregivers go to work. So all of these things we have to investigate, and clearly then it needs to lead to some sort of policy changes in the education department, but also at a level of the municipality and bylaws in terms of health and things like that within the municipality. And the last stages are going to be basically increasing awareness and education programs, and that too is a form of intervention. And then ultimately, the sort of mantra that one has about exposure to heat is shade, rest, and rehydration. In other words, if you provide good shade, then children are protected from the direct heat.
And how long will the project last?
So we're going to be doing this over 3 years, and we're going to be it's a very tight time frame. So we're going to be doing a single round of hot months monitoring in all 3 sites, and a single round of cold months monitoring to do all the tests and things like that that I mentioned to you on these children. 300 children in each of the 3 sites, so that's 900 children in total. Takes quite a long time to do. We're not expecting to have definitive answers. We're hoping to put into place interventions at a very pilot level to see, at least to be able to say this is reducing either the heat stress in children, or at least in reducing environmental heat exposure. That's what we hope to show. And we're also hoping to be able to show that heat is definitely impacting on the lungs. And unfortunately, we as researchers, or we as health professionals, can only engage at a local level, provide our communities with the resources and the skills that they need to address what is going on in their local environment. But ultimately, we need to address the causes. We as climate epidemiologists, we know that by the end of the century, we're going to be skirting 3 degrees rise. 3 degrees rise on an average on the planet is going to probably mean around 3.2 to 3.4 degrees rise in Africa. And that's our children. That's the studies that we're doing now. And all we can do is provide our children with the knowledge and the awareness, and educate them about pathways to changing the direction that the planet is going in.
Do tell us also what journalists can do.
Open the doors to what is going on in our communities at all of these levels in terms of environmental exposures, whether this is air pollution, whether this is water pollution, or whether it is heat. That's so critical, because that provides the impetus for politicians and policymakers.
Thank you so much. And thank you for giving us these compelling pieces of research with which we are able to tell that story. Thank you, and good luck with the project.